prevalence and risk factors of nocturnal polyuria in female overactive bladder syndrome. The stage is yours.
I'm Dr. Xiao from Taiwan, Pfizer Memorial Hospital. Let's do it.
Yes, just the forward arrow.
Sure. Oh, okay. Okay. Thank you. The
Now,
topic
why are
of
you
my
getting excuse me. The red blinking light is for, I should have said this before, is for the camera. It's not to tell you to stop talking.
Because otherwise you'd have stopped.
Yeah.
Just go.
Okay, my topic is prevalence and the risk factor for predicting nocturnal polyuria in female patients with overactive bladder.
I think that's what was confusing people.
So the hypothesis of this study is, even though the nocturnal polyuria may decrease the treatment efficacy of overactive bladder, so the adjuvant medication such as desmopressin may be added for treatment of nocturnal polyuria in patients of OAB. So if we know the knowledge of MP might be important for the treatment for female OAB. So that's our arm to describe the prevalence and the risk factor of MP for OAB. So between the 29 and 2018, all women with OAB visiting a medical center are reviewed. And we classification of OAB into the OAB weight and OAB dry. The definition of OAB weight is that if the patient have at least one episode of urgency incontinence, that we call it OAB weight. And OAB's definition is based on if you have one episode of urgency, that is OAB. So the definition of MP in our studies, based on the compound definition, that if the woman older than 65, the percentage should be more than 33. But if the below the 65, we use the criteria of 20. So about about 1,000 women, we find the prevalence of MP is more than 65, 16, but below the 65 is the 35%. I think the maybe related to a definition. So, but in you see the table 1, the prevalence below the 65 is about 30. So, but after the other women is about 20. But when we perform the multivariable analysis for predicting nocturnal polyuria, we find has 5 factors we can use to predicting the MP. About the age, poverty, OAB weight, daytime frequency, and nocturia. But however, we perform the ROC curve analysis and find I think the most useful factor is the nocturnal episode in 3 days. Is more than 5. The area can be reached to 0.8. But if you use the age of poverty and the OAB weight and the daytime frequency, the area is too low. So I don't think it's a useful parameter. So my conclusion is very simple: is that you can use the nocturnal episode to predict the MP using your 3 days bladder diary more than 5. I think it might be a good predictor for MP. But so you treat an OAB patient with more than 5 MP in her 3-day bladder diary. Sometimes if the efficacy not so good, you may add another adjuvant therapy. It's my talk. Thank you.
Thank you very much. Are there any questions from the floor? Yes, please.
You showed on your slides claims on predictivity.
Yes.
I don't think these data allow any such claims. What you are showing are associations, and until those associations are also found in an independent cohort, I think the term prediction is completely inappropriate.
Oh, thank you for your question. But you know, association is only 1-to-1. But I perform a multivariable analysis. I use a stepwise. We can detect the independent variable, not only one by one. You know, so that's an independent factor. I'm sure the factor is a real one.
Thank you. One other question, because you looked into it and we saw a presentation from Carl Everett last year. Is there anything you found in your diaries in regard of the bladder capacity? Because that would be a quite good hint, because you made the bladder diaries in these patients.
Yes, we have, but I don't remember the table. Maybe table 2. We have the data, but I think that is another independent factor for in my analysis, not important.
Okay.
So,
thank you very much for your presentation.
thank you.
Thank you.